Hi, Nick here with MedTech World. JD Friedland from Cleveland Clinic Ventures is right here with me. Big M&A guy on the scene, right?
I do have a bit of that in my history, yes.
And advisory, and your history is very substantial. It's the biggest names in the world in that list, including Roadshow.
I've been known to be here and there at times.
Brilliant. And where have you been focusing the past decade? What has been your...
So for most of my career, it's really been medical device focused. So as you mentioned, as an advisor to companies, as a board member to companies, I've really sort of developed a skill set around helping development stage medical device companies navigate the real treacherous pathways from ideation through commercialization and a successful outcome for the entrepreneur.
And I guess the power play, naturally, I'm imagining it's they that come to you for your assistance.
I'd say today certainly, because I'm at Cleveland Clinic and we have capital and entrepreneurs want or need it. But I'd say throughout my career, it's really been a symbiotic relationship. I've established and developed relationships with entrepreneurs, with investors, and with strategic players in the medical device field. So by virtue of those connections, I happen to find myself in situations where I can be helpful to third parties.
Great. What's on the agenda for now? What's changing?
Yeah, so I'd say there's really three strong trends that we're seeing from the Cleveland Clinic perspective in medical devices, and really it speaks to the three themes that we're focusing on in innovation in MedTech. And so the first is an area that Cleveland Clinic has a very strong clinical capability in the field of cardiology and cardiovascular medicine. So we have a number of portfolio companies in the area of structural heart, where really being able to repair and replace heart valves using a transcatheter technique have really taken storms. TAVR is sort of the four-letter word that everybody talks about these days, but we believe there are a number of innovations across that sector. The second area where we're really excited is in the area of neurostimulation, using an electrical impulse to affect a therapeutic response along a neural pathway. We have multiple companies in that space. And then the third area is an area I'm particularly excited about. We haven't come up with a better name for it, we call it surgical visualization and navigation. So really using AI, new visualization techniques, and real-time imaging and delivery capabilities to allow the clinician to be more effective, either in the OR while they're performing a procedure, or in a radiology environment where they can quickly diagnose and recommend therapy for a procedure.
So as I see it, just from an overview, you look at those are three areas where your company sees there is major opportunity in the future. You create a portfolio of companies with specific technologies along there, and there's the fact that there's many companies within specific technology. Is that beneficial for them that you're all working together?
So first of all, you make it sound like so much easier than it actually is. I wish it was as simple as you just explained it, but that's generally true. There certainly is synergy in a few fields. Number one, we have a ton of clinical expertise, and by virtue of the fact that we've started or are investing in multiple companies in each of those target areas, we develop muscle memory and expertise in guiding those companies, but also in working with financial investors who have an affinity to those areas, and then with strategic players who see those as strategic priorities themselves. So we have very regular dialogues with sort of the likely suspects in each of those verticals, because it's an area that they're focused on. They have a portfolio of products and solutions in that space, and they want to hear about what Cleveland Clinic thinks, what our clinical and research leaders' opinions are about innovations in the space, and then what we have in our own portfolio that could be complementary or really revolutionary relative to their portfolio of products.
And then merge and acquire as need fit.
Correct.
You're going to want to save your voice because there's a lot of people going to speak to you. But today, this event, Malta, do you want to talk to me about your experience in Malta?
So this is my first time here. Very excited to come here. I mean, it's a beautiful country. It's a beautiful island. I've had a chance to walk around yesterday and this morning, and living in Cleveland, Ohio for on a full-time basis, it's really nice to come here and feel warm weather in October, which is something we do not have in Cleveland these days. But certainly it's a very welcoming environment. It's a very active conference here. It's very exciting to see so many people. in a single location who are excited about MedTech.
Brilliant. JD, going to say goodbye. Thank you for talking with us.
No, thank you.
Cleveland Clinic, JD Friedland.